Excellency, Honorable Minister of Health and Human Services, Dr. Fawzia Abikar Noor, Minister of Health, Puntland, Jama. And it gives me a great pleasure to welcome you all to this historic event, the first public health conference for NIH. As you can see, the theme is laying foundation for health research. The main objectives of this public health project and research conference was to give young and future researchers a chance to publish their articles. And also, the foundation is also a sort of capacity building. I want just to say that, and many thanks to our scientific committee who are seated here, most of them, and some of them are online, that we have received over 100 articles. And these articles, out of the 100 articles, 12 of the articles was already published in other journals. And the criteria for having these journals was to make sure that this article was never published before. And this was one of the criteria. And also, the students were given opportunity and a selection criteria. It was, we had a selection criteria for having the abstracts accepted. One of them is that you must have a clear objective defined, methodology of the research, and results. And those students or researchers who were not able to meet this, they were coached and guided by the scientific committee to make sure that all the papers were not just rejected, but to be given a sort of capacity building. Out of over those elements, 53 abstracts were accepted, and today we will have most of them presented here. Distinguished ladies and gentlemen, as you know, Somalia as a country has experienced numerous challenges after the civil war sectors, including public health, that has been negatively impacted. As a result of our public health institutions have been rendered almost dysfunctional, and the capacity to carry out core functions of disease surveillance and response to health emergency has remained substantially weak over the years. This can be evidently attributed to the outbreaks of vaccine-preventable diseases, including measles and polio in many parts of the countries. Distinguished guests, despite these challenges, I'm very proud to inform you that the Federal Ministry of Health in the recent year has started to rebuild and strengthen the country's public health system through adaptation of necessary reforms, establishment of institutions like NIH with mandate to oversee key public health functions. To this end, I'm glad to inform you that under the leadership of Her Excellency, the Minister of Health, Dr. Fawzia Abikar Noor, the National Institute of Health was re-established at the federal level in the year 2018 with a mission to build resilient systems with capacity to prevent, promptly and detect public health risks and emergencies. In furtherance of this mandate, the Institute, through support from its partners, has already begun implementing several initiatives. Just to mention from these initiatives, with support from African Field Epidemiology Training Program, WHO, Swedish Public Health, we have managed to train and successfully graduate the first cohort of the frontline health workers in the basic field of epidemiology. The graduates of these trainings are intended to provide capacity to the Institute's for carrying out disease surveillance and to monitor public health emergencies. In addition, through support from WHO, the Institute has started to implement recommendations from the International Health Regulations 2005 that Somalia is abiding by the development of necessary guidelines and creation of relevant task force committees whose mandate was able to coordinate and oversee the implementation of IDSR, Integrated Disease Surveillance Response, and the IHR activities. This year's conference, being another milestone for the Institute, gives us an opportunity to reflect on the state of our healthcare systems and to better understand where we are now as a country and where we want to go in a few years to come. Distinguished ladies and gentlemen, as we start off this conference today, I would like to urge you to keenly follow the presentations from our presenters, and at the end, invoke your minds towards making recommendations for improving the overall health outcomes of our citizens. Last but not the least, allow me to recognize the efforts of contribution made by our partners, Swedish Public Health, WHO, Affiliate, and all the federal member states. Lastly, I would like to once and for all to welcome you and once again wish you a fruitful duration throughout your stay for these 3 days in the conference, and welcome to Diriye and the conference. Thank you.